This should hardly be controversial. 6-month-old Sylvester is getting his second dose of vaccines. Mom's decision to vaccinate him was entirely voluntary. Like almost everyone here in Denmark, she opted in. In America today, the conversation is very different.
You're just getting more and more vaccines. Logic would state that at some point, there's going to be a breaking point.
My husband and I got together, I'm like, we're not vaccinating our kids. He's like, what?
Here is what's in your childhood vaccines right now. Gelatin from boiled pigskin.
We still haven't done the science. That's just like remarkable to me. So let's just inject our children here.
There are some massive changes happening to the childhood vaccine schedule in the United States. And one of the goals is to make the United States vaccine schedule more similar to peer nations. Peer nations like here in Denmark, a country of 6 million people, a country with universal health care, a country with a lot of trust, and a country that gives the fewest doses on their childhood vaccine schedule. So the question for a lot of people is, can they do in the United States what they've been doing here in Denmark?
Earlier this year, the U.S. government stopped recommending 6 vaccines for children.
We took the vaccines that are the vaccines that other countries give, our peer nations in Europe. One of the things that they're convinced of from experience and science is that if you add too many vaccines to the schedule, that uptake goes down.
American health officials declined our request for an interview. Leaders of the movement to make America healthy again say that giving kids fewer vaccines will increase trust in the vaccines they do get. So, will those changes lead to more people then vaccinating their children? That's the hypothesis we've come here to test. Edith and Kenneth, both 35 years old, are new parents. Very new parents.
Well, first of all, congratulations.
Thank you.
And how old now? 13 hours?
I think so. Yeah. A little bit still cloudy.
Yeah, I bet. How is the whole process here of delivering a baby? You know, for people who don't live in Denmark, what's it like?
It's been a really good experience. It's just very easy.
And all covered. I mean, this is a nationalized healthcare system, so everything is... No, you're not going to walk home with any bills.
Not at all.
Do you worry about vaccines at all?
I think with COVID, there came a little bit of kind of like a worry. Not that it was big enough that I didn't take the vaccine, but in general, no. If they advise it, I would take it.
Edith's confidence in that advice is built on a foundation of positive experiences with Denmark's health system. Denmark has long recommended fewer childhood vaccines than the United States. Babies here leave the hospital without any shots. By the time they're 12 years old, most Danish children have gotten vaccines against 10 diseases. Now compare that to the United States. Until recently, American officials recommended children get vaccinated for 17 diseases. Now 6 of those are still available, but no longer recommended. Hepatitis A and B, meningitis, rotavirus, flu, and COVID-19. Some of those, like hepatitis B, are still a serious threat in certain parts of America, but not in Denmark. About 6 in every 100,000 Americans are diagnosed every year with chronic hepatitis B. Compare that to less than 2 per 100,000 in Denmark. That means around 18,000 Americans diagnosed every year compared to about 100 in Denmark.
Fundamentally, this is a story about trust in the medical system. So we've decided to come to one of the biggest hospitals in Copenhagen to meet one of the most trusted doctors in Denmark. So this is a referral hospital.
That's right. If the condition is very serious or they feel that it actually warrants more expertise to handle, they would then transfer the patient in here.
Dr. Jens Lundgren sits on the panel that decides which vaccines to give Denmark's children.
Did it surprise you when you heard that the United States is trying to emulate their vaccine schedule on Denmark?
I certainly didn't see that coming. You cannot just take what has been carefully thought through in one geographical location and just extrapolate that and generalize that.
I think part of the reason that they emulate Denmark is because Denmark has the fewest vaccines on the schedule.
But you see, that's not a good argument, right? So why do you want to condense your vaccine program against the fewest vaccine? You want to have the right vaccines for the public health that you have in your population. I mean, that's just common sense in my mind. And you have a problem in managing a measles outbreak that continues to evolve, right?
Hundreds of cases of measles in a single state now. And we've had several measles outbreaks.
You don't need my degree or my expertise to say there's something fundamentally wrong.
You believe these vaccines that we're talking about on the childhood vaccine schedule, you believe they are safe and effective?
Correct.
That's not the concern
That's not the
here.
debate here.
So what is it fundamentally about?
We have come to realize that it's entirely based on trust.
Trust.
The trust, parents need to trust when we come with a new vaccine into the program, they need to trust that that's very sensible to do, and they would therefore adhere to that.
Lundgren and his colleagues are now considering adding another vaccine, the one for chickenpox. But we keep coming back to that word, trust. The polling shows it. Most Danes trust their government. Of the world's most advanced economies, it ranks near the top. And here's the United States, dead last. Just 28% of Americans trust the government.
We've come here to do a medical story,
Yeah.
but in some ways this is a cultural story.
It's a cultural and yes.
And not just about vaccines, but about trust
Yeah.
and about attitudes and things like that.
Absolutely.
In the United States, trust in vaccine information from the CDC has dropped 12 percentage points since the beginning of the second Trump administration. Danes' trust in government goes far beyond vaccines. Even after parents leave the hospital, child rearing looks a whole lot different here.
I want to show you something pretty extraordinary. We've come to visit 2.5-month-old Esther. Of course, we expected to find her inside the house, given how cold it is, but instead, here she is in a stroller outside, freezing cold temperatures.
You'll see this everywhere in Denmark. Parents swear by the fresh air for their heavily swaddled babies. The family is waiting for a home health nurse to arrive, who will come, free of charge, 5 to 6 times during the baby's first year of life.
Så det er, men det er en rytme, vi gerne vil prøve at lande lidt bedre i. Både for Sallys skyld, men jo også for Esther, så de får en bedre relation. Ikke?
Hi, Busy.
Soon, baby Esther wakes from her nap, and it's time for her exam.
Du ser stærk. Ja. Skal vi starte med at veje dig? Eller skal vi starte med at måle dig? Hvad? Jeg får et smil.
I have to say, just visiting Denmark, to see Esther outside initially, that was quite striking. I mean, it's freezing cold outside.
It's not even as cold now as it has been.
And what is parental leave here in Denmark?
So my first 2 parental leaves were 12 months each with full payment.
And then you show up as well.
Yeah.
5 to 6 times a year.
Yeah, the first year.
The first year.
Yeah.
And what is the purpose of your visit?
My main purpose is to check up on the child to see if the child is developing and is attaching to the parents.
What I'm struck by is Denmark is so different than the United States. You're here. Parental leave, nationalized healthcare system.
Obviously, there's a lot of people in the US who are not that fond of the government actually running anything at all.
And I think it's easy to implement something like a more simple vaccine program, Signe visiting us here, because it's a smaller country. I think then in many ways you can compare US and Denmark, right? It's 2 completely different countries, right? And it's run differently and politically, governmentally. But I would want for the people in US to have some of the benefits that we experience, because I do believe it benefits me as a parent. I believe it works. So I basically trust the system, right? That they have decided it for me and it works.
Vaccination isn't the only reason that outbreaks are less common here in Denmark. The National Serum Institute, or SSI, here in Copenhagen, keeps meticulous medical records of all Danish citizens, and that helps predict and even prevent outbreaks.
What makes Denmark's superpower this data tracking?
Well, the underlying superpower comes from the Social Security number introduction in the 1960s. And from there, the linking at this place where you're looking here, we track the disease incidents from all the physicians. Whenever someone is tested for something, it goes into one database. Whenever someone is vaccinated, it goes into one database. It doesn't go to all kinds of places, it's one place. And then it's quite doable to link all this together.
Americans might be uncomfortable with that level of tracking, but it is one of the many factors that makes the Danish system work.
If you feel like one side is soft,
Community
one side
bonds
get a
here
bit
are
of
tight.
resistance.
This is just one of many places new moms gather to meet and learn with their new babies.
Hello, everybody. Your babies are very cute. Do you all have trust in the vaccine system here in Denmark, by show of hands? Okay. Would that trust go down if they added more vaccines? No. So adding more vaccines does not lead to less or more trust.
After spending a week here, it's easy to see why American officials would want to emulate Denmark. It's often ranked as one of the happiest countries in the world, and it's easy to see reflections of the movements to make America healthy again here. Danes emphasize personal health to ward off disease, and they are skeptical of too much medical intervention. But the success of the Danish system is based on so much more than the number of vaccines parents give their children. Nationalized healthcare, high trust, and a lot of codependence on one another. Edith, the new mom, she also seems wise beyond her years.
We have so much trust in the system that if they say yes, then I would do it. I wouldn't understand why there wouldn't be trust. I think it would be the entire system that would need to be looked at.